Hello, everyone, and welcome to Beyond COVID, the new podcast from Compassion in Politics, where we try to take a step back from the horror and heartbreak of the current crisis to ask, what are we learning from it about how we all live? Can we build back better after the crisis? And what opportunities does it provide to do things differently? My name is Jennifer Nadel, and my co-host is
Matt Hawkins, and today we are thrilled that Dr. Phil Hammond has joined us on the show. Phil is a physician, comedian, presenter and writer. As well as touring with his own stand-up shows, Phil writes the Medicine Balls column in Private Eye, presents Music Group on Radio 4 and continues to work as a practicing doctor at a specialist NHS centre for children with chronic fatigue. He's also the author of several books, including Staying Alive, How to Get the Best from the NHS and What Doctors Really Think. How are you coping with the lockdown, Phil?
I'm coping very well. I'm currently in self-isolation because my daughter has COVID-19, is coughing her way through that. I did volunteer for frontline care early on, even though I'm 58. Chronic hypertensive, I haven't intubated anyone for 32 years, and I was known as Dr. Fumblefingers at medical school. I'm notoriously clumsy, so I think the NHS has been saved that I've not been needed in the southwest, where we're coping probably best in the UK. So I'm running all my clinics from Skype and trying to avoid being infected by my daughter at the moment.
And how well do you think the current crisis is being handled?
The thing that confused me, I guess, is that ever since Jon Snow took the handle off the pump in Soho and stopped the cholera outbreak in the 19th century, and we founded the essentials of infection control, and that was always to hunt down the source, so track and trace, and then to find out any people who'd been in contact, and then to isolate. So those basics of infection control have served us in every pandemic since. And the mysterious bit I don't understand is we seem to abandon those halfway through and say we weren't going to do contact tracing. Time will tell whether that's a huge calamity. Germany, a country of similar size, with the same warnings in advance about what was happening in China and Italy, very brutally went after the virus with its contact tracing, and at this stage has far fewer deaths, and crucially far fewer deaths amongst frontline health and social care staff.
They had the tests, didn't they? Because there's no point tracing if you're not able to test people to see whether they really have.
That's true, but the very fact that we said in early March we were going to stop testing and are now trying to do a U-turn on that means that we fell behind on testing capacity, fell behind on getting the reagents, etc. It's not a simple test, it's an unpleasant test, because if you do the test to see if you have the virus is a throat swab. So the person giving you the swab is at risk of getting the virus from you because you have to take cells off the back of the throat so they may cough or sneeze at you. So you need adequate protective equipment. Then it takes 5 days for it to come back. So it's not a brilliant, simple test, but the German efficiency, and yes, it had the labs to do it, has meant that it's traced better, but it was also lucky. So Italy also did loads of tests, and yet had that appalling outbreak where thousands of people died. And the key difference seems to be that in Germany, the initial outbreak was amongst people coming back from skiing holidays, so relatively fit, healthy people who were likely to become silent super spreaders. And they picked up that early and tested and isolated them. Italy was incredibly unlucky that the infection went to an area where it had a very high elderly population and it had high levels of pollution and smoking. And it just caused absolute devastation there. So the reasons Germany are handling it best are not just because of their testing, they had some luck as well.
Absolutely. And as a doctor, what do you think are the greatest challenges that frontline staff are facing at the moment, and what can be done to address them?
Well, it's interesting. I mean, overall, from a bed's point of view, the NHS appears to be coping well. So we thought Easter weekend was going to be the peak. NHS England did extraordinary things. It freed up 33,000 beds by cancelling routine operations. It did an amazing deal with the private sector to use those beds, and it built the Nightingale hospitals from scratch in London and in Birmingham in a few weeks, which is extraordinary. And we hunkered down because our model said Easter weekend is it. And yet only 19 of the 2,000 beds at the Nightingale hospital were needed. COVID wards in hospitals were busy, but other parts of the hospital were eerily silent, and accident and emergency departments had 25% less traffic. And we all heaved a sigh of relief thinking, hey, we're coping with this really well. And then the death figures started to come in. And the latest figures we had in a single week up to, I think, to the April 3rd, there's been 6,000 more deaths than in the average of the previous 5 years for that week. And over half of them don't have COVID-19 on the death certificate. Now, that could be because we're not doing community testing, that GPs are reluctant to put COVID-19 on some death certificates. But it could also be that because the entire focus of the NHS is on COVID-19 and people are petrified, they're staying indoors, they're not seeking help when they have heart attack, stroke, sepsis, appendicitis. And there's now evidence coming through that some children may have died or been harmed because they weren't able to get help or didn't seek help. There are people going blind because they're not seeking help for detached retinas, etc. So this was always a really complex situation to manage. And I just fear that by focusing all our eggs in the COVID basket, we're missing a trick with all the other diseases. Cancer isn't going away, etc. And of course, the economic costs. We can only fund the NHS if we have taxes. And if we keep people indoors, there's no taxes. So it's probably the most complex situation you can imagine. And I'm glad I'm not the health secretary, but I'm not entirely convinced yet that we've managed it in the best way. And we've got to get better because there will be another pandemic. There's bound to be if we carry on, particularly what we're doing with animals.
Now, Phil, you just said you wouldn't like to be the health secretary. I am going to put you somewhat in that position. You have previously tweeted that when we emerge from this pandemic, every country must make the health and well-being of people and planet their paramount political concern. The same resolve that's gone into fighting coronavirus must fight child malnutrition and suicide. What can we do to make that possible?
Clearly, a pandemic is a global challenge, but all these risks that kill us are global challenges. No risk is an island. Just taking the things that we breathe, smoking kills probably 8 million people a year, including 1.2 million innocent bystanders who suffer from passive smoking. Half of them are children. Polluted air kills 7 million people a year. These are figures far greater than have died from COVID. Malnutrition kills 5 million kids. Tuberculosis kills 1.4 million people every year and has done for years. Malaria, 1.2 million, etc. So if you're thinking about massive suffering and avoidable harm on a global scale, there are things out there that have been going on for years that we've turned a blind eye to because it hasn't affected our pension plans and it hasn't affected people on cruise ships and hasn't crashed the economy. Actually, we need to turn that round and recognize that we are all connected. The way we live on this planet is what's been causing most of these conditions, and we need to, particularly to be kinder. I had a lovely old GP trainer called Brian, who was a Yorkshireman, and he used to say, "Do you know what the most powerful drug in the world is? It's kindness. Works for everyone, very hard to get the dose wrong, and it's free at the point of delivery." And that sort of culture of intelligent kindness needs to start with being kinder to animals. So we know that 70% of these catastrophic pandemics start in animal populations, and animal husbandry, butcher, slaughter, veterinary practices in some parts of the world are completely unacceptable, as was highlighted after the SARS outbreak of 2003, that we stopped becoming a pandemic because of brilliant global health work. But the key lesson was we've got to stop doing what we're doing to animals. That probably started with horseshoe bats in China, and this one probably started with horseshoe bats in China, possibly the live animal markets. And I read in the newspapers that they've reopened again already. So, we're sowing the seeds for the next pandemic. So it's clearly a global problem, and we are only going to solve it globally.
You touched there, Phil, on what one might tentatively describe as your political philosophy based around kindness. And you have considered standing for Parliament before, and in fact very nearly did at the last election. So what policies would come top of Phil Hammond's manifesto?
Jacinda Ardern has been a bit of a hero of mine for a while, but I was very taken with her budget that she did probably about a year ago now, where she actually expressly said in her budget, "We will make the health and well-being of people and planet our paramount political concern." So this is the political concern that trumps all others. This is the prism through which we see every other policy. How does it affect the health and well-being of people and planet, particularly the most vulnerable? We're fighting over ventilators in the NHS. The Central African Republic has, I think, 3 to 5 ventilators for a population of 5 million people. We sort of forget that massive inequality and social injustice are the key causes of not just premature death, but long-standing suffering. So if you're rich, you're likely to live at least 10 years more than poor people within your country and have 20 more years of disease-free living. So unless we address those health inequalities that we've known for ages, and certainly since the Black Report in the 70s, just before Margaret Thatcher came into power, and we've sort of neglected them. And, I'm not fiercely party political, I'm far more evidence-based, but I'm vaguely encouraged that suddenly a Conservative government is having to put so much more money into helping those who need it most. And we need to make sure that we don't go back to the bad old ways as soon as this is over.
So, Phil, what would you like to see happen that would lead to those changes? How can we actually use this, harness this moment so that something positive comes out of it?
I think there's only so much that politicians can do. I've always argued that we need I call it a B-Day revolution from the bottom up. We need to rekindle our communities, and it's lovely that people are rekindling their communities, that people are desperate to help. I mean, the culture of intelligent kindness has spread faster than the virus, and there are so many people who want to volunteer. They want to look out for those who need it most. They want to help people in social isolation because they know that's really bad for your health as well. That's what I hope will endure. People are talking to their neighbours when they previously wouldn't have done, and that's the thing that happens in a crisis. We have to rekindle our communities. We can't think of ourselves in isolation. I talked about countries and risks out of isolation. We need to build up those communities. And David Cameron, mentioned things like the big society, and everyone chuffed and laughed at him because he was a tough Tory. But that's the thing that we need, but led by the people. The politicians will hopefully put the money in the right places. But we need to take, very overused phrase, take back control in our communities and our workplaces and support each other. And I can see part of that culture happening already. We just need to sustain it. And we need to devolve power as much as we can to frontline, to community.
On that point about goodwill, some people have said that we should not be celebrating quite so enthusiastically people fundraising for the NHS, that it's turning it into a charity where the government should be providing all of the funding. What's your reaction to that?
That's, again, quite a harsh political view, isn't it? Poor old, that wonderful former soldier who's raised millions walking up and down his drive. We should celebrate that because part of the fundamentals of your own emotional health is the sense that you're giving back to others. So to criticise people for raising money through charities is wrong. There's also an argument, yes, we do need to fund health and social care more properly. And the one that I've always cried out for is hospice care. We know we're all going to die. We need to make those deaths as gentle and kind as possible. So why is hospice care the one final common pathway that we all go through, largely charity funded? So I think end-of-life care, particularly in health services, needs to be properly funded. And particularly now in this pandemic, we've learned that actually for all the money we're putting into building new hospitals and ventilators, we can't save that many people. Yes, we can save the younger people who get it, who've got good lung capacity and fight, and it's very distressing to watch. But for the vast majority of elder people, we cannot save them, and the best we can hope for is to give them a decent, humane death. And so I'm hoping the focus will move a lot more onto decent end-of-life care. People will talk about death, they'll make their end-of-life wishes known. They'll understand that once they get into their 80s, they may not have long left, and they need to talk about these things. And all of that, I think, needs to be under the remit of the state, in collaboration with hospices and charities, but we certainly need to be funding end-of-life care better.
And that brings me to ask you about the way the NHS is funded and the way that it's run. Obviously, before the crisis, there were lots of fears and accusations that it was being effectively privatised in some ways. What concerns do you have about that and the internal market? Are we running our NHS as efficiently as we could be?
Well, my high blood pressure dates back to my one and only appearance on Question Time when I was up against Andrew Lansley, who was the Health Secretary who brought in the Health and Social Care Act, which came in 2012. And I said quite simply, this is just going to splinter up the health service. We're not going to be able to provide integrated care because you're splintering it up with multiple different providers and power structures. Whereas we need a seamless service where people don't fall through the cracks in the service. And we've seen a bit of that here, actually. No one's sure who's in charge of the NHS at the moment. Is it Matt Hancock in the Department of Health? Is it Simon Stevens in NHS England? And what is Public Health England? Who's in charge of that? All these little fiefdoms, all fiercely fighting their own battles. NHS England's actually done pretty well in terms of getting the beds out there, but who's really in charge of the masks? Is that the government's thing, the PPE? And Public Health England took over the testing and then weren't able to deliver. And that partly goes back to those reforms and the way that we don't have clear lines of accountability and power. And the same goes with splintering things up to private providers. Now, if you can show me a private provider who delivers better outcomes and value for money for the NHS without disrupting NHS services and taking all the business away from them, then that's fine. But generally, there's not much evidence that marketisation of healthcare delivers a better service. So we need private ingenuity to come up with new treatments and tests and things, but I think a unified public health and care service under one big umbrella is where we need to go after this.
Thank you, Phil. In our final few moments, we're just going to have a slight change of tack. Can you tell us what is the one thing you struggled with most during the lockdown, and what has been your go-to coping strategy?
The one thing I've struggled with is that I made a truly appalling prediction on Twitter that more people would die falling down the stairs than from coronavirus. And I did it in January at the beginning of this. I've left the tweet up and I've retweeted it and said this hasn't aged well. I'm not somebody who hides from my mistakes. But I think that context is interesting. It's been a really useful error for me to have made, actually. It's all very easy as a journalist. You float above it all and you snipe at everyone and say, oh, you should have done this. And I'm actually, in a way, quite glad I made this appalling error. And the reason I did, firstly, in the 2003 SARS outbreak, I made the same observation, and 1,000 people died falling down the stairs in that year, and nobody in the UK died from SARS in 2003. So that gave me false confidence. And then my lovely wife, Jo, had just fallen down badly and fractured her ankle. And so I was slightly obsessed with the danger of falls. But in the 10 weeks since I made that prediction, 15 times as many people have died from this virus than falling down the stairs. So it's really quite humbling to know that you can be badly wrong. And our politicians can as well. It's important to realize in a pandemic, nobody knows how it's going to go. You might have to do a sudden U-turn. That's fine. You just want people to level with us. So I'd like them at briefings to say, actually, I think we got this wrong. Actually, we should have tested a bit more earlier. Perhaps we should have locked down a week earlier. That's what I'm looking for. The one comfort I've had is the basics. I'm very lucky that dogs themselves can't get coronavirus, although of course they can be a vector. Your dog can get covered with somebody else's saliva and spread it. But the company of dogs is amazing because they're cheerfully optimistic and they're not looking as if they're in pandemic panic. And I'm very lucky. I mean, that's the issue about all this. If you live in a nice area, you've done reasonably well in life, you can float serenely above the pandemic and not all be crammed into one room and desperately struggling for money and having to go out to work even when you're ill because you're starving, etc. And that's the thing we always forget about this, is that whatever the risks out there, we say Boris Johnson getting infected is a great leveller. Well, yes, people were surprised and shocked by that, but I wasn't, because he was shaking hands with people in COVID hospitals and boasting about it when he'd already said we should be doing social distancing. He was unlikely to get it severely. 92% of people in his age bracket actually don't need hospital admission, so he was unlucky. But then, of course, he was very lucky to get immediate admission to intensive care under the care of the country's top respiratory physician, rather than being intubated by a retired gynecologist in a repurposed conference centre. I think it's taught us about the power of connection. I'm connecting with my family, my friends, my dogs through ingenious means. I have Zoom meetings with my pub friends every Wednesday. We get a few beers out and the banter is just as good as it was when we were actually going down the pub. And that's the takeaway message. Connection is vital for health. And just because we're doing personal distancing actually doesn't mean we need to do social distancing. There's a difference. You can connect with your friends, your family, your mum living on her own through technology, and we need to keep doing that for however long this lockdown lasts.
So, Phil, if there was one message you could leave our listeners with, what would it be?
I think it would be that life always has been about living with risk. We take complex risks every day in our lives. You know, teaching your kids to drive is probably the most dangerous thing you'll ever do. Really frightening at the beginning, but they manage it. We learn how to walk down the stairs without falling down them. We manage complex risks all the time. And one day we're going to have to come out from being locked in our houses and realize it's safe to go outdoors again. We'll never be completely safe. There's no such thing as zero risk. But human beings are amazing in their capacity to bounce back. I said at the beginning of this in Private Eye that there was a danger that fear of coronavirus could cause as much harm as coronavirus. And my hero, Nye Bevan, called his autobiography In Place of Fear. Back then, there was a war on then, and he realized people couldn't afford healthcare. They were dying in pain. They were frightened of calling the doctor as well as of dying. And he turned that round with the NHS. And we need a similar intervention down to take fear away. So manage your risk. Don't be fearful. Try to have 5 portions of fun a day. That's my take-home message.
Dr. Phil Hammond, thank you so much for joining us.
You're welcome.
Beyond COVID is part of the Real Agenda Network, produced by Kitty Horlick and brought to you by Compassion in Politics. And next time, We'll be talking to the psychologist Dr. Kristin Neff, who's based at the University of Texas, and we'll be talking about the power of self-compassion and what psychologists think of Donald Trump. So I hope you will join us. We would also love to hear from you, so please do get in touch with any comments or feedback. You can find us online at compassioninpolitics.com or on Twitter. And of course, we'd also love you to subscribe and spread the word about the podcast. You can find us on Apple, Spotify, or any of your other favourite podcast providers by searching for Compassion in Politics. Thanks again for joining us, and we look forward to being with you again soon.